Hi everyone. Welcome to my latest series of videos called Complex Things Explained Well, in which I will do my best to give you the tools to make good, sound decisions about your pet's health by describing common pet health conditions the same way that I would describe them to a client in the consult room at my own practice. And before we get into it, please remember to hit that subscribe button and tap that bell notification icon so that you get notifications when new videos are published. And if you'd like to help me decide on which health condition to address next, then please join me on Patreon, because my Patreon supporters do get to vote on which videos I make next. So, without further ado, let's get into it. Hi everyone, and welcome to a much delayed but very important video that Mr. Pirate and I are making for you. Now, today's video is going to be on feline idiopathic cystitis, or why does my cat pee all over the place? Probably the question that is most associated with feline health problems, and also one of my biggest pet peeves, because people always say, if you ask anybody who's never lived with a cat or has lived with a cat, one thing people always say is that, oh, cats, they pee on things. And this drives me absolutely nuts, because here's the thing. Healthy cats do not pee on things. When a cat pees inappropriately, so out of their litter box, it is a health problem, and most of the time it can be managed. Now, those of you who've seen the Story of Lancelot video know that not 100% of cats who pee inappropriately can be managed, but Lancelot is an exception. He's 1 in 10,000. Most cats who pee inappropriately have a health condition that I'm about to discuss with you, and when managed appropriately, they do not pee out of the litter box. The takeaway that I would love for everyone to get from this video is that cats don't randomly pee on things. If your cat is peeing somewhere out of the litter box, it has a medical problem, you should go investigate it. Don't blame the cat for peeing inappropriately or being naughty or whatever. Not the cat's fault, health issue. And it's a health issue that is, quite frankly, quite manageable. And of course, this is the video that I made that I had 3 backups of and still managed to lose it, which is really made me sad. I really wanted to have this out like weeks ago. Hey buddy, I know, so sad. Here, why don't you face our friends. Roar. So I made that video using a little boy cat named Rosie, who was a poster child for the condition because he actually had FIC, and I videotaped it with him on his last day of hospital stay. Mr. Pirate is also a poster child for this condition, although luckily he does not have it. What do I mean by this? Well, inappropriate urination is typically a problem that you see in neutered indoor male cats who are very sweet in nature. And this is a neutered indoor male cat who is very sweet. Now, it can also happen in female cats, but it's less commonly identified. Why? I'll explain in a moment. Let's just really solidify what I'm talking about here. We're talking about blocked cats. We're talking about inappropriate urination. We're talking about peeing out of the litter box. All of this stuff is actually the same disease condition. And all of it is and we're talking about the urinary tract infections, we're talking about bladder crystals. All of it is actually pretty much one health condition. 98% of cats who come in with appropriate urination do not have stones, do not have crystals, do not have UTIs, even though traditionally they have been diagnosed as such and managed as such, they do not. That percentage goes to down to 92 or 94% over the age of 15, meaning that even with older cats, a vast majority of them that show up with urinary issues do not have bladder stones, do not have an infection, do not have cancer, they just have FIC. And FIC is a inflammatory stress-triggered disorder. I'll say it again. It's a stress-induced problem. So, yes, when we have a cat showing up who's peeing inappropriately, we do a urine culture to make sure it's not an infection. We do urinalysis and x-rays to look for crystals and stones. These are things that you do need to rule out, because again, you don't want to miss that 5% of cases on average that do have them. But a vast majority of these cats will not have crystals, will not have an infection, and yet they can't pee. They're blocked. And And there's a spectrum of presentations here, from the cat who pees out of the litter box, to a cat who's straining to pee but can't produce any urine, to a cat who can't pee at all. But it's all part of the same problem. Now, it's a stress-induced disorder, and of course, really sweet male indoor cats are a little bit more prone to being stressed out, because again, cats are neophobic. They're scared by new things, and the way they burn off their energy and burn off their stress is through exercise and hunting and exploring. So an indoor cat might explore a bit less. He might be less used to changes in the environment, so might be more prone to stress. And male cats have a narrower urethra, and where this matters is because what this whole problem is that when cats get stressed, their bladder becomes inflamed. Super weird, right? But that's just the way it works. When cats get stressed, they get inflammation in the bladder, and then this inflammation becomes self-perpetuating. And once a cat gets stressed, their bladder becomes inflamed, and once it gets inflamed enough, the urethra, which is the outflow from the bladder that goes to the outside world, will literally swell shut. And as it starts to swell, the cats will get like a burning sensation when they pee. That's when you see a cat starting to pee out of the litter box, or straining to pee and only producing small droplets of urine at a time because it hurts. And of course, when they can't pee and they're in pain, it stresses them out more, so they get more inflammation. And then eventually, in some cats, the urethra can just swell shut and they cannot pee at all, even though they keep trying. And this really becomes a medical emergency at that point. The reason we see this more in male cats than female cats is because females just naturally have a shorter, wider urethra. So even when the female cats do get these FIC episodes, they are less likely to get blocked. So they're less likely to be presented to the vet, and they're less likely to end up in an emergency room. It doesn't mean they don't have the problem, it just means they tolerate it better. Whereas males have a longer, narrower urethra, so that they're more likely to be seriously affected by this kind of stress-induced inflammation of the bladder. Now, when a cat is blocked, sometimes it will have a bit of mucus and crystals in, usually in their like distal penis, if this is a male cat. And historically, this has been misinterpreted as the cat having crystals, and the crystals get blamed for the problem, whereas really they're just a symptom of the problem. And again, this is where it's important to do a proper workup on these cats, because again, like a small percentage will actually have crystals or an infection or something, but vast majority of them do not. So because this is a stress-induced disorder, traditional ways of managing it have been very frustrating. Many of you who have owned cats over the years probably have had the experience or have heard of people whose cat gets blocked, has to go to the hospital, has a urinary catheter replaced. Having a blocked cat is the extreme case of this condition. But modern sort of evidence, in fact, by modern I mean we've known this about 15 years ago, once we figured out that this is actually a stress-mediated disorder caused by a swelling and a spasm of the urethra, we started managing it medically. And if it's diagnosed properly and managed early, you can reduce the likelihood of that cat getting blocked by a huge percentage. Like some of them will still get blocked, but most of the time when you get that scenario where you're going to the vet at 2 a.m. on Christmas Eve because your cat hasn't been able to pee for a day, it's because they've actually been probably clinical for many days, and for whatever reason it's been missed or it's been misdiagnosed. If you catch these cats early, you can use oral medication, so painkillers and muscle relaxants and anti-anxiety medications to help them relax and help that urethra unclench, help the urine flow, and usually within 10 to 14 days, everything settles down and they go back to being normal cats. So what do you have to watch out for as a pet owner at home to notice that your cat might be having this issue and to act early? First of all, urinating out of the litter box, or going to the litter box frequently but producing only small amounts of urine each time. You can check on this just by looking at the clumps of urine in that box and seeing if you see tiny little clumps of litter instead of like a nice big clump like you normally get when a cat pees. And so if you see your cat showing those signs, go to the vet early. Don't tarry. Because if you get them early and you get them on those muscle relaxants, get them on anti-anxiety medications, then the problem will just go away. It might take up to 2 weeks of treatment, but it will go away. If you know that your cat is predisposed to this, because this is a condition that has a genetic predisposition. Pirate, for example, he pees like a fire hose no matter what. He does not have this problem. He's been through a lot of stress in his life. We've moved a lot. There've been a lot of changes. He doesn't have this problem. We're good. But if you know that your cat has this problem, if you know that your cat's been predisposed to this, because if once it happens once, it's going to happen again because this is just a part of who they are. You can take steps to mitigate their stress and prevent them from developing this condition because again, it's stress triggered. So if you can minimize the stress in their life, often you can prevent them from going clinical. You can prevent them from actually developing and narrowing their urethra, peeing on your couch, and then maybe getting obstructed and needing to go into hospital with a catheter. There are many ways to manage cat stress that I talk about in some of my other videos, but it kind of breaks down into a couple categories. One is environmental modification, because boredom equals stress in cats. So creating an interesting environment for cats is a huge part of welfare, particularly for indoor cats. We're not going to talk so much about outdoor cats because it doesn't really happen in outdoor cats, and they already have a very rich environment if they're going outside to explore. But in indoor cats, you want to provide them with viewing perches so they can kind of go up on a high place and look out windows, look down on you wherever they are in the house. You want to provide them with lots of toys. I'm probably going to make a whole separate video on how to manage stress in cats. But for now, I'm going to give you guys a resource that I really, really like, and I think that everybody who has an indoor cat should look at. It's a website. It's called the Indoor Cat Initiative, and I will throw a link to it down in the comments below. The Indoor Cat Initiative website is run by the Ohio State University Veterinary Medical Faculty, and it is full of ideas of how to make your indoor cat's life less stressful and more exciting. Games you can play with your cats, how to set up your home for cats to find it interesting. Just a lot of really good information. I think every cat owner will enjoy looking at it, or every cat butler actually. So yeah, have a look at the Indoor Cat Initiative website. But setting up your home, environmental modification, huge part of keeping cats entertained and stress-free. The other thing that I always recommend for managing stress in cats is remembering that cats are neophobic. They don't like change. Cats are both a predator and a prey species. Anytime things change around them, it makes them very alert, it stresses them out, because anytime there's change in their life, they're immediately on the lookout for opportunities, they're on the lookout for predators and dangers. Change is stressful to cats. And when does change happen? Well, it happens around the holidays, when you have people coming, friends over, you're throwing parties, you're maybe going traveling, you're decorating a Christmas tree. So around the holidays is often when we see these kind of problems arise. When the family goes on vacation, when their favorite person leaves, when their favorite person comes back from college to visit. Anytime there's a major change in the household, a cat who's predisposed to this condition can develop FIC. And again, there's many acronyms for this: FLUTD, FUS, FUS, blockage. FIC is the one I like to use because it's the most accurate one, feline idiopathic cystitis. Although it's actually slightly less accurate because it's not really idiopathic anymore. We know what causes it. It's caused by stress. So it's a really feline sterile cystitis, but that doesn't sound as good as an acronym. So feline sterile cystitis doesn't sound as good. It just sounds like we're hissing at a cat. Psst. See, he doesn't like it. So, again, so environmental enrichment, minimizing changes in the cat's life, and something that I referred to previously on my YouTube videos, a thing called Feel Away. I'll refer to this product quite a bit. I'm not being paid to talk about it. It's just something I use a lot in my practice, and it's a tool that works well and gets the job done. Feel Away is a diffuser that aerosolizes a synthetic version of a cat's cheek pheromones. It kind of works like one of those Glade plugins, except instead of making your house smell nice, it makes your house smell like feline cheek pheromones, which we can't sense, only cats can detect it. See, cats have these little glands in their cheeks. It's actually on their lips. These tiny little glands on the inside of their lips that produce a pheromone that they use for territorial marking. That's why they rub their cheeks everywhere, and you'll see them wiping on corners and wiping on people they like. Just get away that the cats will mark you as their own territory. So Feel Away makes their house smell nice to cats, and it's really effective as a low-intensity, low-cost intervention to reduce stress in cats. If you're expecting a stressful event, such as you're throwing a party, you're going away, you're moving, you're putting up a Christmas tree, having this in your house will help the cat deal with the stress so that they don't throw a massive, adrenaline-mediated stress response that could lead to other health problems. Now, people have looked at using anti-anxiety medications in cats who are predisposed to this condition. Things like amitriptyline or Prozac have both been studied extensively and used a lot. Unfortunately, the evidence doesn't really support their use. It seems like, to the best of our ability to tell, these oral anti-anxiety medications don't seem to be effective at preventing FIC episodes. Having said that, it could be just the weakness of the studies we use, and in very rare cases, if we have a cat that really has multiple episodes of FIC, look that way, the camera's that way, mate. No, it's over there. No, it's over there. What? So in cases where we have a cat who has multiple episodes of FIC, I will sometimes put them on a long-term anti-anxiety medication, because these medications do work in cats for other problems. Certainly we deal with behavioral issues in cats quite often. Most of the time they're stress related. Often they respond really well to oral medication. So they do have a role in feline medicine. The takeaway that I would love for everyone to get from this video is that cats don't randomly pee on things. If your cat is peeing somewhere out of the litter box, it has a medical problem, you should go investigate it. Don't blame the cat for peeing inappropriately or being naughty or whatever. Not the cat's fault, health issue. And it's a health issue that is, quite frankly, quite manageable. And it's also a health issue that, if not managed, can lead to very severe complications. Certainly cats do die from being blocked, because obviously if you can't pee for a few days, things are going to go terribly wrong and you can die from it. So most certainly this can have very serious repercussions if not addressed in a timely and competent manner. And please, especially if you're landlords, if you own properties, don't assume that cats are going to pee all over the place. This is honestly just a little bit of a sideline, but I find that there's misconception that if you run a rental property and you let cats move in, that you're gonna have to tear out the carpets when the people move away. And yes, I know that has happened, but it's only because the cat has a medical issue that is not being properly taken care of. So, I don't know, this might fall on deaf ears, but if there's people watching this who are renting or who own properties, please, please, please consider the fact that allowing people to live with pets is a really huge, important quality of life thing for them. And that if you have healthy cats living in your property, you're not going to have to deal with inappropriate urination. There's not going to be cat pee smell everywhere. That is not something that just randomly happens. It's not a normal part of cat life. I've personally always felt, and this is something I feel quite strongly about and kind of wish that there was some sort of a citizens lobby group to work for this. I always felt that rather than having apartments that do not allow pets for rental because they're concerned that a cat, for example, might pee inappropriately and ruin the property, what you should have is rental contracts that stipulate that if your cat is sick, you should take it to the vet. Otherwise there's a penalty, and then your property will be protected, and the cat welfare will be protected, and then people can actually live with pets instead of having to struggle to find a place to live without pets. So that's my little public service announcement at the end of the video. I hope that this has really shown some light on inappropriate urination in cats, maybe dispelled some myths, maybe given you some tools with which to address your own cat's health issues. If you find this useful, you can ask me questions in the comments below. I don't promise I'll answer them, particularly if they're clinically related, but I'll do my best. You can also save them for a Q&A session that I'm going to have at some point. I do occasionally have little live stream Q&As. Or you can contact me on Patreon, and if you're one of my Patreon supporters, then we can have a bit more of a conversation about it. So thank you for watching, and kiss your cat for me.
Well, I hope you found that to be educational and helpful. If you'd like to see more videos like this, I would really appreciate your support, which you can express by joining me on Patreon, where I have a wonderful community of patrons already, or by getting some Squishthatcat merchandise like this t-shirt. I also have mugs and a bunch of other stuff, so please support me. I look forward to making more videos like this, and until next time, have fun with your pets, and I'll see you again.